Hey guys, I'm Tristan from Hello Smiles and I'm here today to talk to you about how to properly brush your teeth. So in this video, we're going to cover types of brushes, how we brush, types of toothpaste, and also flossing. First thing we need to look at are tools of the trade. The toothbrush, manual or electric. Which one's more effective? Well, any brush is good, but an electric toothbrush will do a much more thorough job for the same amount of brushing time. Regardless of which option you choose, the brush head is the most important part. A soft bristle head is the most effective for removing plaque without damaging the enamel of your teeth. It might be really tempting to go for the hard bristle toothbrush, thinking that it's going to get rid of a lot of plaque, but it will actually cause damage to your enamel over time. Let's make the analogy of a soft bristle toothbrush is like a nice soft sponge, whereas a hard bristle toothbrush is like a really abrasive scourer. If you're using this all the time, you're going to cause damage to the enamel, and that's what we're trying to protect. A question I often get asked as a dentist is, how often should I change my toothbrush? Well, ideally, it's every 3 months until the toothbrush is frayed, or whichever comes first. Toothpaste selection. With so many different toothpastes on the market, where do you even start? Fluoride. Always start with fluoride. Fluoride is really important because it protects and strengthens our teeth from the acid attack which occurs whenever we eat or drink. On the topic of toothpaste, we get asked all the time about charcoal toothpaste. Do they whiten the teeth? Do they strengthen the teeth? Are they any good? From the research we've read, charcoal toothpaste can be quite abrasive, so although it might whiten the teeth initially, it's going to really damage the enamel long term. If you did want to whiten your teeth, our recommendation is steer clear of the charcoal toothpaste, look for a toothpaste in your local supermarket that has peroxide in it, or come in for a whitening treatment at the dental practice. So how much toothpaste do you need on your brush? Well, a little pea-sized amount, like so, is about all you need. Anything more will be unnecessary. When it comes to toothbrushing, everyone has their own technique, but as long as you're not scrubbing backwards and forth too much, doing a circular motion will be better, and getting every surface of every tooth, then you're doing it right. The key to good brushing is making sure you're brushing morning and night for 2 minutes and not using too much force. If you have braces on, that provides an extra challenge, and it's not a bad idea to brush after every meal. So what about overbrushing? Can you brush too much? Well, yeah, you can. If you're scrubbing or you're brushing for more than 2 minutes, it's probably more than you need to. It can lead to abrasion of the teeth. The enamel and the dentine can actually get worn out over time, and also gum recession. Another good tip to get the most out of your brushing, which we're never told, is to spit but don't rinse afterwards. That'll keep the antibacterial and fluoride paste on the teeth a little longer so it can be more effective. If you do want to get into a little bit more technique, having the toothbrush angled on a 45 degree towards the gum and following the contour of the gum line will give you the best clean. So when should you floss? Well, ideally, if you floss before you brush, that will get rid of the gunk that's between the teeth. The fluoride in your toothpaste can get in there and strengthen those teeth afterwards. So to recap, always use a soft bristle toothbrush head, an electric toothbrush even better. Brush twice a day, morning and night, for 2 minutes with a fluoridated toothpaste. Nice gentle action, and don't forget to floss. If you have any other questions, drop us a comment below or give us a call here at the practice. We're always happy to help.